Hi everyone, so in this video I want to talk to you about the levels of bone loss that can occur in the top jaw when you're replacing a full set of teeth with dental implants. Now I want to be clear, this doesn't apply to if you're just replacing a couple of teeth here or there and you've got the vast majority of your own teeth. This is specifically for those situations where either you have no teeth or the teeth you have are in such bad condition that they need to be removed. And quite a typical way of treating these kind of cases, or these situations I should say, is using an all-on-4 technique, or a way of doing treatment where you remove all the bad teeth, you put in the implants and you have a fixed bridge, put on the implants on the same day. Now, typically, a lot of people who have this treatment have suffered gum disease in the past, and they've been told numerous times that the amount of bone isn't enough to have dental implants. So this isn't strictly true. So in the top jaw, there's usually 3 levels of bone loss, or I like to categorize it in my own head in 3 kind of patterns. So for me to explain this pattern, I need to show you an X-ray. So this is an X-ray, it's called a panoramic X-ray or an OPG or a DPT. There's a whole bunch of different names for it, but this is a really standard dental X-ray. It's not a CT scan, but it shows us some key parts that we need to look at. First of all, we can see the bottom of the bone. Okay, so this is, if you were to rub your finger over the gum, just underneath the gum, this is what you would be feeling. The second thing is these kind of dark spaces on the top left and top right. These are the air sinuses, and these are bits that we should ideally avoid to put our implants in. So inside our cheekbones we have air sinuses, which are just pockets of air, and as you lose teeth, these pockets of air get bigger, which means you lose bone from the inside without being able to see any differences if you were to look inside the mouth. That's why having proper CT scans and X-rays before any of this kind of treatment is really, really important, because we don't know where your air sinuses are. Now, the amount that these air sinuses change, or how big they are, is really variable among different people. So the best case scenario is where the air sinus is still really small, like in this X-ray, and we could effectively place upright implants all the way across the arch without any problems. Okay, this is the gold standard, and it happens very rarely. Now, the most common situation is the air sinus does get bigger towards the back of the mouth, and then to have the implants coming out as far back as possible, what we do is we angulate the furthermost implants. And by angulating them, it means that we can use longer implants, engage them in more bone, and then we can use more upright systems at the front. But it means that where the implants come out is as far back as possible, meaning that you can replace the maximum number of teeth using this kind of method. Of course, you could have sinus lifts on both sides and have upright implants placed there, but it's complicating things, and with a treatment which is already expensive, adding sinus lifts to the treatment is going to increase cost, complexity, and time to get your end result. So the vast majority of people go for a system like all-on-4, which is kind of what I'm describing here. Now, sometimes these air sinuses can get problematically big, okay? So the next kind of, I'm going to say it's an extreme because it is where you've hardly got any bone to place your implants in the top jaw. Now, in these situations, it doesn't mean you can't have this. It just means we've got to change our game plan slightly and use different bone. Okay, so what we would do in this situation is use zygomatic implants. Now, zygoma is this bone which you can feel at the corner of your eye, the bit that your cheekbone, the bit that sticks out, that's your zygomatic bone. And it's about 5 centimeters, between 4 and 5 centimeters from where we want the implant head to be to support a full set of teeth. So what we can do is place an implant which goes in through the mouth but engages and gets fixed to the zygomatic bone. Okay, and on an X-ray it looks like it goes through the sinus, but actually there's a little membrane around the on the inside surface of the sinus, and we push that membrane so that the implant doesn't actually go in the sinus. The membrane goes around the implant, and eventually you could get extra bone formation around the implant there. Now, different surgeons do this in a different way, and personally I don't do zygomatic implants because this is such a rare kind of situation. I just don't have enough patience and practice to confidently give this for my patients. So I get a specialist surgeon in who does a lot of these in the situations where my patients might benefit from a zygomatic implant rather than a standard one. Now, there is also a kind of a halfway house between the two, because sometimes the air sinus can be a little bit big so that we can't put an implant in at the ideal angle, but there's still a lot of bone around that we can engage. So in these situations, we do something called a trans-sinus implant, which effectively means we put the implant in the same way, but like we did for the zygomatic implant, where we push the membrane up and then put it through the sinus, we can use that same kind of technique. Again, the end goal is to get at least 4 implant heads coming out in the ideal position so that you can have a fixed set of teeth, ideally in one day, but at least at the end of your treatment plan you'll have a full fixed set of teeth which look great, function great, and are easy to clean as well. Okay, so if you've been told by your dentist or someone that you can't have this kind of implant treatment because there's no bone, they could well be right. They might be saying, for them to provide that treatment, there's not enough bone, but there are techniques out there, and if you see the right person, then they are able to point you in the right direction so that you can have that end goal of a fixed full set of teeth. So I hope you found it useful. If you've got any questions, comments, leave them below, and about once a month I do try and get back to everyone. If you want to see the kind of stuff that I do, I post a lot of it up on Instagram, and you can check out my Instagram channel there. And again, yeah, if you've got any questions, if you want me to make a video about a specific kind of topic, just put it in the comments below. And although I don't get back to absolutely everyone, I do read all the comments. Okay, so I'll speak to you soon. Take care.